Whatever I mentioned to you in my first talk is we are trying to implement there in our organization. The healing touch, next slide please. The vision is through various initiatives with health as a tool, we will forge the self-reliant, strong and cohesive knowledge and expertise to create this vision. Next slide please. This is the current hospital which is called as Dr. Hedgewar Hospital in Aurangabad, which started as a small 10-bed hospital from the borrowings from the parents of the doctors who came together. 7 doctors, they came together. Next slide please. We were 7 doctors in 1989-90. We treated 7,600 patients. And now last year we treated more than 1,80,000 patients. Previous slide please. But the credit of increasing number of poor patients goes to the increasing number of inflow of dedicated doctors. We were 7, now we are 42 doctors. All are working on a subsistence salary, which is enough for a middle class life. They are all experts from the different field, maybe orthopedic surgeon, a gynecologist, an anesthetist or a surgeon. And they started working together. And now the institute has treated more than 37 lakh patients. Next slide please. There are 4 streams of caring, not just health. And those 4 streams of caring are, one is rural health, one is slum health, another is income generation, etc. Empowerment and education. We are running 7 health centers supported by this hospital in slums and rural areas, which are completely free, which are ideal healthcare center for the community. But the beauty is not into the kind of service we provide, but the beauty is there that the doctor is staying in the slum with his family for 24 hours, available for the community. And for 4 hours he is a doctor, for the rest of the 20 hours he is a social worker, a thinker, a facilitator. And then he and his wife start different activities which are required for curative and development of the organization, people in the community. We are using healthcare as a tool for social transformation. The very purpose of forming this hospital is not just to provide medicine and do surgery, but to create an environment in which a social transformation can happen. Next slide please. This is the map of the slums of Aurangabad. We are catering to 37 different slums of Aurangabad in just 3 rupees every day, completely ideal healthcare supported by the hospital. And there are many rural mobile clinics also. Next please. You must have seen and observed what is a slum. Generally the slum is formed and constituted by the migrants from the rural area. They are unskilled, they are fragmented into caste-wise clusters, they are unorganized, socially economically backward, and that gives rise to poverty, lack of education, opportunity, health awareness is not there, no social amenities, lack of health services. This is all the background in which we work. Next slide. And this is a vicious cycle of health. As we are using health as a tool, if there is poverty, there is issues of health. If there is literacy, there are issues of health. Lack of awareness, loss of opportunity, emotional weaknesses. This is a vicious cycle from which a poor man doesn't escape. And we are intervening at each such point so that he is escaped and the health is achieved. At poverty, for example, yeah, go ahead. For example, she is a lady, she came as a patient in one of the rural mobile hospitals. And Varsha Jadhav, she is a polio-struck lady, limping always. She had a small dry land, there was no irrigation, she had no money, her husband had died, she had 2 children, she had to educate them. She would have exposed to high interest loans if she wanted to do anything which she was afraid of. Even there were hassles in seeking loans. So a small self-help group which